So yeah, now we can move on to our panel discussion. And thank you very much to Brenda, Carmen and Jane for coming back into this. And maybe don't forget to take yourselves off mute when you need to, because we will pose some questions to you now. And I'm just going to go through them as they've come in, I think. So bear with me as I go through these. So there's a question from Jane in Glasgow. This one's for you, Brenda. And Jane's asking, well, first of all, congratulating you, well done. And she's wondering if you have thoughts on how you'll use your findings to influence local and national good food plans in Scotland to change the circumstances and impacts that you have outlined, both for young children and for mothers.
Yeah, well, thanks, Jane. She could be sitting in the room next to me, actually. She's not. But in terms of my recommendations, my early report, I've got a report sitting in front of me that's got 80 pages. I need to get it to 30. And in terms of the recommendations, you know, there's at least 20. And they range from at policy level, you know, things like where we best start stops and school starts. So what do we need in that in-between time? So there's gaps in provision. So basically to address the gaps in provision, and also that the mother and child should be protected. They should be protected. And, you know, there is other research around the world at the moment in terms of actually giving them a pregnancy payment. So there's different things that are coming up that definitely at policy level, things need to change. And I do have an opportunity, because we're so close to the Scottish Parliament. I had the Public Health Minister in the other week there, and, you know, we will be actively talking to people, the politicians, and there's an election in Scotland next year, so you might find that they want to listen a wee bit more. In terms of community, ensuring that we expand our remit in terms of mother and children support for professionals and mothers in the community, and just try and upskill people as much as possible, and try and help people around being comfortable talking about cash and accepting cash and handling cash.
Yeah.
So.
Thanks, Brenda. Yeah, there's a lot of work for you to do, as all of us, but yeah, thank you for that. The next question is for Carmen, and thank you to Sarah for posing this question. The food prescription projects are so interesting, and she's wondering if there's any that have taken a farm to consumer approach, so also trying to support local farmers. So I did see you had a great quote up there from a local farmer saying just how rewarding it was for the farmers. But yeah, if you can expand on that, that'd be fantastic. Thanks, Carmen.
Yeah, so several of the GusNIP produce prescription projects do have a model that focuses on improving patient access to their local or regional food system. And some programs source directly from farmers markets or provide community supported agriculture, which is like a food box. Some work with food hubs so that participants can redeem their prescription directly with a local grower. And we see a lot of benefit from that. The patients gain access to their local food markets and also knowledge about their local food markets and a relationship with their farmer, which the social connectedness piece I did not get into in this presentation, but is a huge benefit of that we're seeing from produce prescription projects, and the connection with the farmer is one of those social connections. And so this also benefits the farmer because we have a publication coming out later this year about the farmer role in GusNIP, and many farmers are in this work to connect with their local community and really care about helping with food insecurity. And so it's there's definitely dual benefit, and I would say there's triple benefit, because patients gain access to the produce, and then farmers also have revenue, and both gain this like stronger sense of community connection. So yeah, there are lots of like farm to patient, farm to consumer models, and they're really promising. Thanks for the question, Sarah.
Fantastic, thank you. Now one for you, Jane, and this is one that Laura's taken the words out of my mouth. I was quite surprised to hear your statement about the Household Food Security Survey module not being, I guess, accurate or sensitive or whatever the word is to really deal with that infant age. So Laura's question is, what modifications or additions would you recommend to alter that HFSSM to better represent food insecurity indicators for children 0 to 24 months?
Yeah, thanks for the question, Laura. Laura works in Leslie's lab, so she's helping with that new project we're working on. But thanks for the question, Laura. And so I guess the indicators that I showed you today are from that North American survey, are the infant food insecurity indicators that Leslie and I and others are currently going through the process of validating, so that they can potentially be questions asked to families with infants under 24 months of age. So the goal with going through this process, first we had done a survey before the North American one with a larger set of potential indicators of infant food insecurity that were created based on existing literature and interviews with food insecure women. And then from that survey, we did some statistical analysis to pare the number of indicators down. But those indicators are all in relation to economic constraint that we'd be interested in for this household food security survey module, since the questions for adults and children are asked in relation to economic constraint. So we would still be missing potential infant food insecurity practices because of formula shortages, for example, if they continue to occur. But anyway, long story short, to say that we're working through the validation of those indicators that I showed to you on the slide today. So worrying about running out of formula and feeding formula to the baby while breastfeeding, specifically because the mother's worried about her diet. So those types of nuances for both breastfeeding and formula feeding. I hope that answered your question, Laura.
Great, thanks, Jane. Another question for you, Carmen. Paige is wondering about, in the GusNIP, how the cooking skills workshops are run and have these impacted on physical and mental health outcomes among participants?
Yeah, so GusNIP projects pair, especially in produce prescriptions, because it's a healthcare based service. There is a requirement to have some level of nutrition education, and within that nutrition education, the grantee can choose what type of nutrition education to give. So that's very tailored to community needs. And there are a lot of like cooking, skill building workshops, and the workshops are typically delivered by partners in the community. So we have a cooperative extension network, local nonprofits that partner. We had a program called SNAP Ed, which was very sadly recently cut. But those type of partnerships are usually responsible for delivering the nutrition education. And the goal is to help participants feel confident preparing the fruits and vegetables, but one of the co-benefits is that social connection, which we're hypothesizing is related to gains in mental well-being. A lot of grantees, so we have this core set of evaluation metrics that grantees can pull from for their programs, and a lot of grantees are, ask us about a mental well-being indicator to include in their evaluation because they do see such benefits from participation for their participants. And we are really trying, actually in the next year or two, we're really trying to untangle like what is that connected to. And yeah, so we're hypothesizing it's connected to the social connectedness of all of this and the wraparound support that's provided by these projects, and really like the tailored nature of it all to meet the community where they're at.
Fantastic. We have 4 minutes to go. There's a couple more questions in the chat. I am going to take the chair's prerogative and ask one more. Unfortunately, it's a really big one. So maybe just a couple of words from each of you. And it's a big one because I'm asking, what do you think could be done? This is a question from someone in the audience again. How can we approach global action knowing that the problem is similar across regions, but also vastly different at the same time? What can we do to drive sustainable support for women and families to alleviate food insecurity in all of our communities and settings across the globe? That's a big one. Maybe
I'll go
Brenda.
first. Sorry. No,
No. Go.
Yeah, to me, you have to find commonality. You find the common thing that everybody's, is the problem. Connect, and as I said before, use your power and your expertise to drive it.
Yeah, thanks, Brenda. Jane or Carmen, want to add to that? Or does that encapsulate it?
Sure, I'll just say that perhaps something like what we're doing with Nourishing Futures Network is actually bringing people together from different countries, because from our work we know that there's similar social and structural drivers to food insecurity and potential solutions based on those drivers, but they manifest or are nuanced depending on the context of the country or the community. So I think we just have to work together to identify those big things that can potentially be changed, and then on a more local level, working within our public health system and our healthcare system, how changes can be made at the local level.
Thanks, Jane. Carmen, final thoughts? No pressure.
So many thoughts. I think a couple of learnings from the GusNIP program and some other policy work that I've focused on is really centering participants of programs in the program design so that they can make sure these types of interventions really reflect their own priorities and the realities that they face every day. As helpers in an intervention, we don't always understand what those realities and priorities are. So making sure that there's some inclusion there. I think the integration of wraparound supports, like in the GusNIP program, a fruit and vegetable prescription or incentive isn't going to solve food security. Like at the end of the day, it's $45 to $100 a month. And there's much bigger issues connected with food security. And so I think when programs build interventions, that they have to be careful to also have wraparound supports to address all of the various issues that families with children face, which are, beyond having so many competing priorities. Just being a family, being food insecure is very tricky. And then I think networks like this are amazing because it's so important to invest in research and evaluation of these programs so that we can understand what works, but it's also really important to have avenues to share what we learn globally. And then what I always say is adapt them locally and really leverage like the food systems that folks are in and the in those adaptations and the needs of the local community. So those are 3 thoughts. We could write a paper on this one.
Indeed, yes, thank you. That's fantastic for those final thoughts from all of you. Just to quickly wrap up, we've hit the end of our webinar time frame. I will quickly just share this just in case, actually no, I can't, I was going to give you that QR code again. We really would love you to join the network if you haven't already. We've also got a Delphi study ourselves. So Kaya, who is part of our audience, she is running a Delphi study so we can come together and work together on solutions to this issue. So please participate in that if you haven't already. Good, thank you, Kaya. The closing date is the 6th of October. I thought I'd better put that in there in case people watch this recording before or after the 6th of October. So if you can get onto it as soon as possible, that would be fabulous. Thank you so much, everybody, for dialing in, no matter what time it is in the morning and night and afternoon. It's been so fantastic. And as I said, I'm energised. I feel really great about all of the great work that everybody is doing. So thank you so much for participating, and look out for some future events with our network and join it. All righty. Thank you very much. Bye-bye.